I am Dr. Venkataram, Mysore, dermatologist, dermatopathologist, hair transplant surgeon and director at Venkat Center for Skin, ENT and Plastic Surgery, Vijayanagar, Banashankari, Cunningham Road, Bengaluru. Can we use body hair as a donor hair and transplant it to cover baldness on the scalp? The answer is yes. Does it work? Yes. How? Let us see. There is what is called a concept of recipient influence. What it means is, when you take hair from one area, such as body, and put it onto scalp, gradually over a period of time, over 2 to 3 hair cycles, the body hair starts developing the features of a scalp hair, which means it starts growing thick, it starts growing longer and longer. On the body, it never grows more than 1.5-2 centimeters. On the scalp, it can grow 6 or 7 centimeters. This principle is used for treating baldness when the scalp donor is not enough. This technique of using either beard hair or the body hair has, in a way, revolutionized the treatment of baldness because it has expanded the donor. Previously, only the occipital scalp, this much was the donor. We could get 4,000 or 5,000. Now, if somebody has a good body hair on the chest, we can get 10,000 also. So, any stage of baldness, stage 6 or 7 baldness can now be treated. The technique is the same. Anesthesia is given on the body part through a slightly different technique called tumescent anesthesia, and then FUE method, that is you make holes for each hair and pull it out, is used to extract hair and then it is put into this area. How well does it produce result? Now that's an important question because body hair has certain characters. 1, it is a thin hair. 2, it is usually a single hair unit. You don't get 3 and 4 hair units on the body. And 3, its inherent ability to grow long is limited. It can grow 5-6 centimeters, but it can't grow 20 centimeters. For these reasons, body hair is usually mixed with scalp and beard hair. You never use body hair as the only hair for a particular area. You can use these different steps and the result in these photographs you can see here. And body hair, since they occur as a single hair unit, you need large number of body hairs to cover a small area to produce the same effect as scalp hair. Roughly, you need 4 to 5 body hairs to give the effect of 1 scalp hair unit. So, for this reason, body hair can never be a first choice treatment. Body hair is never used as a solo hair. It is usually mixed with scalp and beard hair. To give an analogy, body hair is effective in covering the surface of the scalp. It is less effective in creating bulk. That is something which has to be understood. To summarize, body hair is a safe, effective, outpatient daycare modality of treatment. It is very useful in those who have less donor area on the back of the head. But it takes longer to give result, it is slow to grow, and it is always used in combination with scalp or beard hair. And it needs more expertise, more practice, and needs an experienced hair transplant surgeon.